Okay. Good afternoon, everyone. I'm so excited for you all to be here. Welcome to the third webinar of the Environmental Health Webinar Series. My name is Eliza Bowling, and I am the CDC PHAP with the National Indian Health Board, and I will be your moderator for today's session. Today, Peter Mann will be sharing information about the Healthy Air Project, specifically on air quality, air purifiers, and all things healthy air. Just some housekeeping notes before we get started fully. The session is being recorded, so I'll give you, as I told you before we started recording, if you don't want to be recorded, please hop off the call. No skin off far backs or anything. We want everyone to be comfortable. So if you do not want to be recorded, please do hop off. If possible, if you didn't register or you didn't provide your email address at the registration, please put your email address in the chat so that I can record those, so that I can email the PowerPoint slides and today's recording to all registrants. I have also muted all participants, so please stay on mute until the end. So for Q&A, if you have troubles though, do please send me a message in the chat and I will make sure that we can figure out what's going on and help you out there. In addition to your emails, if you have any questions for our presenter today, just put them in the chat box. We will use those for our Q&A session at the very end, and or at the very end, we'll ask you to unmute yourselves and ask your own questions. When we get to that point, we would like you to turn on your cameras so that we can see who's asking questions and figure out who's going to be the leaders in our session. So I'm excited. Without further ado, I will now introduce our presenter for the day. So our presenter is Peter Mann. He is the CEO of aerosols, which is a leading manufacturer in HEPA air purifiers. He's also the chair of the Association Home Appliance Manufacturers Association, on the Air Cleaning Council, and this organization sets the industry standards for air purifiers in the United States. So thank you, Peter, for coming on. Floor is all yours.
All right. Yeah, thank you so much. Let me just go ahead and share my screen. So can you see that okay?
Yes, we can.
All right. Yeah, thank you. So today I'm really here to talk about indoor air quality, why it's important, and then how air purification fits into that. So while we are, a manufacturer of air purifiers, I'm not really here to, sell our stuff. It's really more about pulling together what the experts say about air quality and, how do you achieve better indoor air quality? And so this is a slide from 2019. So this was before COVID, and this showed where if you look at the top risk factors worldwide for deaths, that air pollution and household air were, making the top 10 list. I don't have a more recent slide after COVID, but it's obviously moved up the rankings. Poor indoor air quality has historically been an issue, and it really got worse in the US during the 70s. During the energy crisis, when there was a push to make homes a lot more energy efficient. The problem there is it really just bottled up everything that was in your house. And so it wasn't ventilating properly. And so now with COVID, it's really brought it to the forefront that, this is an issue that needs to be addressed. And if you look at, where does air pollution come from? Obviously there's traffic and volcanoes. I know in Alaska that's a big issue, but in more recent years, wildfires has been a huge issue. I think today Chicago has among the worst air pollution in the world, and so with climate change, these kinds of occurrences are going to continue and contribute to air pollution, and it really varies depending upon where you live. I know in the Southwest, historically, they've had dust storms has been a problem. Agriculture is also an issue, especially in the Central Valley in California. If you're in LA, the ports are an issue. And so it's depending upon where you are in the country, you have different issues, but they're all related in terms of this fine particulate matter that's in the air. And so, what's interesting is that while we talk about outdoor air pollution, we spend 90% of our time indoors. And believe it or not, most of the outdoor air pollution that the average person breathes in is done indoors. The World Health Organization has really been on top of this, for decades. And 10 years ago, they declared air pollution as a human carcinogen. And the UN last year declared clean air as a human right. And Dr. Joseph Allen, I don't know if anyone's participated in the White House summits on indoor air quality, but he's really been a leader from Harvard. And he has two quotes that I put in here. And one is that healthy buildings represent one of the single greatest public health opportunities of our lifetime. And the one that really sticks with me is that the person who designs and operates your building has a greater impact on your health than your doctor. And it's because we spend so much time indoors and you're breathing in, whatever's in the air in that space. And if it's not properly cleaned or ventilated, it's, it goes into your lungs and your body. And so air pollution can affect your body in a number of different ways. And really what we're talking about here in terms of air purification is the smallest, most dangerous particles. Those are the ones that stay suspended in the air the longest, and it's what you will breathe in, it's what enters your lungs, and it's what potentially can enter your bloodstream. And so that's why it creates, as you can see here, a whole host of potential issues. And in terms of who's affected the most, it's similar to COVID. It's seniors, pregnant women, and children. Those with the weakest respiratory systems typically suffer the worst outcomes. And I've got a kind of a quote here from NIH where they talk about how childhood exposure can contribute to cognitive, neurobehavioral, and emotional problems. We see it with study after study showing lower test scores. I got into air purification 20 years ago because my son suffered with asthma, and it, really affected him. And you can't learn very well if you can't breathe. And I know asthma is a leading cause of absences in schools. And so, clean air is really critical to prevent, things like asthma attacks. It's also, really harmful for adults, especially those that have an underlying condition like COPD or emphysema or any other kind of respiratory issue. And it just kind of compounds that issue. It's really same thing that we saw with COVID. The research is, it's really is in its infancy in really understanding the long-term impacts of this, but the initial studies are already showing a number of impacts to cognitive decline and dementia, as well as, NIH is saying it takes 2.5 years off of your life. And so what we're talking about in the air is particulate matter, and they reference that as PM, and PM 2.5 are particles that are 2.5 microns and smaller. And so in the graphic, the diameter of a human hair is typically around 50 to 70 microns. And so this is significantly smaller than that. If you, think about viruses, those are, 0.1 microns. Those are really small at the small end. And that's really what you breathe in. If you look at wildfire smoke, it's, that's PM 2.5 in many cases. It's really the fine particles that blow around. And that's the focus of really getting proper indoor air quality in place. And so the EPA for, I think, 3 decades now has had strategies to how do you improve indoor air quality. And the first is source control, and that's just simply removing the source of the pollution. So if you're a smoker, stop smoking. If you're allergic to your pet, get rid of your pet. And so in a lot of cases, like you can't or won't remove the source of the pollution, or it's, wildfire smoke outside. There's not a lot you can do to affect that. And then the next step is ventilation. And really what you want to do is turn your indoor air similar to the outdoor air quality. And that's really what the focus of COVID was, is you saw if you were outside, the spread of the virus was much less than if you were indoors amongst a lot of other folks. And so it's really bringing in fresh filtered air from the outside. The challenge is if you have pollution outside or pollen or the temperatures are really extreme, it's really difficult to do that strictly with ventilation. And so if the first two strategies don't work, the third strategy is air cleaning. And what the EPA talks about is really just having a high quality filter and then moving enough air for your space. That's really all air cleaning is. It's conceptually it's very simple, but in practice from an engineering standpoint, it is somewhat challenging. And really what you need to understand is there is an industry standard, and it's called the CADR, or clean air delivery rate. And I'll get into that in a little bit, a couple slides in. Oh, actually the next slide. And so smoke CADR is really the standard that's used, and it sounds a bit complicated, but really at the end of the day, all it relates to is this is how large of a space this air cleaner can effectively clean. And Energy Star has done a good job of certifying air purifiers and being very transparent in terms of the performance and what room size it can clean. And so I've just took a screenshot of our three products on Energy Star, and you can see the smoke clean air delivery rate of 338 equates to a 524 square foot room that it can effectively clean. And what's a little bit confusing here is that the clean air delivery rate is simply, it's just a volume of air that an air purifier can clean for specific particle sizes. And smoke is just a name given to the smallest range. And that's 0.3 to 1 microns. And, based upon that, there's a pretty complex formula that gets to essentially an 80% reduction in the space. And that's how they come up with the translation from the CADR to the room size. But for the average person, you really just want to know, does this clean my size space? And, for this model, it'll clean 524 square feet with 5 air changes per hour, which is really what you should be targeting. Okay, and air changes per hour is really think about the total volume of air in a space and how many times per hour have you filtered all of the air in that space. And, it's been pretty amazing with COVID because before COVID, there was only one standard, which was the AHAM standard, which was 5 air changes per hour. And then in the past year, the CDC's come on board with 5 air changes per hour. The Department of Energy has adopted a new standard, which is the CADR, which is 5 air changes per hour. And I think this was 2 years ago during COVID, Harvard came out that recommends 5 to 6 air changes per hour, especially in classrooms. And, Dr. Joseph Allen at Harvard is, I would say the leading, if not one of the leading authorities. And what they came out with is, if you're looking for air purification, there's 3 quick rules of thumb: is go with a HEPA filter, go for a high clean air delivery rate, and then avoid add-ons like ionizers, ultraviolet lights, or other forms of electronic filtration. The issue is those technologies are somewhat unproven. They have the potential to emit ozone, and in some cases, some can, conduct chemical conversions, and it's not fully tested for everything that may be in your space. And the other thing that Harvard came out with is the 5 air changes goal is in combination with your HVAC system. And so the design standard for most classrooms is 3 air changes an hour. A lot of classrooms are only at 2.5. But to get to 5, your air purifier really just can make up the difference. And so if your HVAC system has 3 air changes per hour, your air cleaner only needs to provide 2 to get to the 5. That's for a commercial space or a classroom. Residential HVAC systems typically just recirculate the air. And so it's not bringing in the air from the outside. So you really need the 5 air changes per hour in a residence. And that's really the main difference between if you're looking for a unit for a residence versus a commercial space. And so the air purifier in a residence, the one I showed earlier, may only clean up to 524 square feet, but if you only need 2 air changes per hour, that's close to 1,300 square feet. And so it really is situational dependent. And so this is a little bit of math, which basically just shows you if you have your smoke CADR and your number of air changes per hour, what the smoke CADR you're looking for. The reverse way to do it, which I think is much simpler, is if you know your room size in square feet, assuming you have an 8-foot ceiling, you just take your room size in square feet by 2/3, and that's the CADR that you need to effectively clean your size space. And, one of the things that we've seen during COVID is this is more on the government side, is there's a ton of government money that came into air cleaning for schools. A number of schools used the money. And now that the money is starting to run out, there's a challenge of we don't have the funds to pay for continuing to use them. And so this is just like a more of a personal belief, is I believe that air purifiers and filters should be accessible and affordable. There's a thing about, getting something for free, but then having this high cost down the road. And so that's been a little bit of a hurdle in some cases, with some folks even taking free air purifiers. And so, our perspective has been a little bit different, is it has to be affordable, because this is a long-term problem. The wildfires aren't going away. Climate change is causing a lot of these problems. And, if you want someone to get the benefits of an air cleaning, it should be affordable. And also, I think there's an education, a perspective change, is, the EPA came out with some data on the cost of educating a student in the US at around $13,000 a year. But, a good quality HEPA air cleaner from a number of different brands, you could get for under $7 per student per year. So on a percentage basis, it's tiny. I think it's understanding what the issue is and understanding the solutions are really very affordable. It's just new. And so, the reason why we're here as part of this program is NIHB won a grant, I believe it's through EPA and CDC, to provide free air cleaners, and I believe one free replacement filter to tribal nations that have a declared disaster due to wildfire smoke. I know the whole Midwest is pretty bad today. I don't know if any areas have declared a disaster, but NIHB has a webpage with a form to fill out. Our product is, we have a couple of products up there, and there's another brand that has some products up there as well to choose from. And, Adriana is the main point of contact. And so anyways, I will stop presenting. I'm happy to answer any questions. I kind of went through that a little bit quick, but air pollution is definitely a health issue, and air cleaning is really not very complicated. But what's complicated is ensuring that what you're getting is actually going to do the job, and that's kind of what I hope to kind of outline a little bit. But if anyone has any questions, I'd be happy to answer them.
Thank you, Peter. That was a really great presentation. As you said, this is the time for Q&A. So if anyone has any questions, either put them in the chat or come off speaker and ask some questions. I also have a few questions prepared as well, but I want to make sure everyone gets a chance to talk. Okay. Well, my first question, because I had a first question. What are some preventative measures that people can take to ensure good air quality in their home or in their office space?
Yeah, so I mean, there's two things. One is your HVAC system. You want what's interesting is the HVAC systems are designed for energy efficiency, like because it's really expensive to run your air conditioner. Um, and and so they're designed to shut off. And the problem is when it shuts off, then the air is not being ventilated properly. And so one thing, if you had a commercial space or even a residence, is if you had it to where it runs when it's not heating or cooling, but it's running in fan mode, at least you're getting ventilation. And then utilize an air filter with a high of a MERV rating as your system can handle. As many times that's up to what they call a MERV 13 filter, and that's what's recommended. And think of an air cleaner as supplemental ventilation or supplemental air cleaning, because it kind of fills the gap. HVAC systems, are really designed to get you 3 air changes per hour, and that's insufficient to clean your air. And so it's not just one solution, there's multiple strategies to ensure that you're moving enough air in the space to effectively clean it.
Okay. I have a couple questions here in the chat. The first question was answered in the chat, but I'll still ask it. Smoke is an issue in the West, but due to the snow we've had this winter, we are seeing a lot of flooding and mold. Will air purifiers help with that?
Yep. So mold is an interesting one. I should have mentioned this. So mold is often, there's a water source that creates it. And so from the EPA's 3 strategies, source control is if you can remove the source of the water, you'll go a long ways to controlling your mold. An air purifier with a HEPA filter will remove mold spores from the air. And so it's commonly used in terms of mold remediation or just having, cleaner air to not breathe in the mold spores. Molds are pretty large particles. Those are pretty huge. And so it's pretty easy to remove those with an air purifier, but really the most important thing is to control the water source. But if you are allergic to mold, then an air purifier can be really helpful.
Okay. Next question. Karen, you asked, is there any way to calculate what the presenter talked about? Is the price per student estimated based on 30 kids, 20 kids, etc.?
Yeah, that was from EPA, I believe, and yeah, I didn't show you like all the details. It was based on 25 kids. It was just an average that they had used. We've done some analysis, and our numbers are around like $5 a kid per year, and that's if you do the initial air purifier. If you factor in replacement filters over 5 years and electricity that you use for those 5 years, it kind of comes out because the filters are a lot cheaper than the machines.
And our last question in the chat so far: how long is this likely to be available? Will it be available throughout the wildfire season?
I think Tree may be able to. Okay.
Yeah, that's an
answer.
NIHB question. The answer to that question, as Ms. G is putting in the chat, is the National Indian Health Board's funding will be available through September 2024. So
Yeah, my understanding is there's a certain bucket of money that NIHB has, and so I would imagine once you have until September 2024, but if the funds are used up before then, unless you're able to get additional funds, that may be the end of the program. Is my understanding in terms of
yes.
getting the
So
air purifiers?
if we have a high need, obviously it will be a very big support to get more funding if funding should run out. But right now, Ms. Dree, part of my NIHB team, did put in the chat earlier, and I will put it in again, where you can register for air purifiers and part of that program. And it has information on that as well. Question from Mr. Robert. Reading. Is there some way I can get an order into the around the NIHB other than the system that is set up online? Does the tribe have to have been involved in a presidentially declared disaster that is or was for wildfire only, or can you allow a disaster that is or was related to another cause? And if that's the case, what years can you go back for the disaster? That is a great question. Let me refer to Miss Dree for an answer real quick. She's typing it to me. I'll come right back to your question, Mr. Robert. Mr. Eric, what's the guidance for air purifiers during wildfires if homes are not well insulated, protected from the outside? Ms. Dree is answering the questions for me as I say the answers.
May I step in for a second?
Thank you.
Okay, I'm at a place, I ain't found a room that I can talk. Good afternoon, everyone. My name is Adrienne Marzette. I'm a manager here at the National Indian Health Board. Mr. Robert, to answer your question, again, I apologize for the inconvenience with the link. What is happening with the Google form is that we are requiring emails. So if your IT department has it set up that you can't access like certain websites that require like IP address, collections, then it's not getting through. So I am working to like get another form via SurveyMonkey that would be the same Google form, and that form will go out with today's PowerPoint. So if you can't access the Google form, we are hoping that you can access the survey form because we did pilot it today, and it seems that people were able to upload their declaration of disaster. And then, so that's the first question. So a simpler way to get access to it is going to be SurveyMonkey. Does the tribe have to be involved in the presidential declared disaster? No. So as federally recognized tribes, you have sovereign authority. Your tribal council has sovereign authority. What we are looking for is official documentation from your tribe, from the tribal council, stating that a declaration has been put in place, a state of emergency, rather, has been put in place for your community due to the wildfires right now. That's what we're looking for. So as long as we have something that is official from your tribal council that is saying this is a public health emergency for your community, that's all that we need. And then the second part of your question was, if that's the case, what years can you go back to? So we are only focusing on this year right now, but this opportunity will also be available until September 2024. So that's this wildfire season and the next wildfire season that you would be able to tap into NIHB for support, financial support.
Okay. Thank you, Ms. Dree. Follow-up question from Ms. Kim. They've had horrible smoke in Minnesota over the last few weeks. They don't have wildfires or any declaration. Is there any way that they can get the purifiers for vulnerable elders who are suffering due to the air being in the red zone? They did have a flood declaration in May. Well, her mute's coming on and off. I'm sure that her previous answer also applies to you as well. But do go through the links, and we'll also send out the new link that she discussed, and it will have more information for that as well. Next question. I do see people hopping off. I do want you guys all to finish out this evaluation survey for the webinar, just so that we can all have that information available to everyone. And the air purifier program is available as well. Do fill those out and make sure that, you guys had a thank you for all for coming. I see you guys hopping off, and we'll just continue to answer some questions as they come in. A question from Carmen. Is there a limit of air purifiers to be provided through the NIHB? Can federal entities apply, for example, Bureau of Indian Education for schools impacted by wildfires? Yes. To answer the second part of your question, yes, they can apply. Obviously, we'll be reviewing if there's anything we need. We'll reach out and let you know. But I do think there is a small limit. I'm not sure at the top of my head what the limit of the number of purifiers is. Oh, answer is 40. There's 40 per request. So you can only limit to 40 per request, and the tribe would have to submit the request for the school, not the federal entity itself. And last question, will the recording be shared? Yes, the recording will be shared. Hopefully I have all your email addresses. If you registered for the event, or you put it in the chat for myself so I can record it later. I'll have the slides, the recording, and I'll also put in the email the air purifier program new link that we will have. But that is all. I do appreciate you all for coming on. Thank you for coming and joining us for our third webinar series. Thank you for attending, and your feedback is valuable, so I do hope that you will fill out our evaluation. We will be having another webinar series, which will be announced in your email. And we are hosting our first Environmental Health Summit in Oklahoma City on July 25th and 26th. So hopefully we all see you there as well. That information is also on the website, NIHB's website, under the Environmental Health page. Thank you for attending, and I appreciate you all. Have a great day.